Sports-related injuries are common not just among athletes, but also entire populations. So joining me is Dr. Brady Heaps of Dignity Health Orthopedic and Sports Medicine to tell us how they can help you with your injuries. And doctor, how are you doing today?
I'm great. Thanks for having me.
So this is really good because we know that we have our professional athletes. We know we have our college, our high school athletes out there, but we also have those weekend warriors who get hurt very easy because they might not have the training as those athletes, and that's where Dignity Health Orthopedic and Sports Medicine comes in to help them rehab, to help them get back, but also to help prevent some of those injuries happening. And big one we're seeing right now, pickleball.
Pickleball. Keeping me in business. It's wonderful.
It is. Let me ask, how do people get hurt doing pickleball?
So it's surprising, right? You'd think pickleball would be pretty safe, but people twist knees, they dive for balls and dislocate shoulders. It's surprising the injuries that show up in my office from pickleball and the ages that show up with pickleball injuries.
Yeah, and so is it more of our older adults who are showing up in the office when it comes to pickleball, or are we seeing younger people too?
More commonly, it's the older adults who are getting active or found a new hobby to pursue. Occasionally, some younger athletes will come in, but it's more the weekend warrior, working their job and just looking to blow off some steam and have some fun at nights or weekends.
Yeah, and I think it's also too, we're looking at people who are hiking, who are, again, doing those big runs on the weekends that they might not have trained for because maybe their mindset's going, well, I did one in 2000, I can do one, in 2023, right?
Yes, and it's, that's a great way to say it because the body's really good at slow adaptive changes, but these sudden bursts of high intense activity, they usually wind up seeing someone like me.
Yeah, all right, so with that, we're in to see you now, and what's really great at Dignity Health Orthopedic and Sports Medicine is that now you guys can kind of like pinpoint what's going on and what the injuries are to help them rehab, but also to, you could say, fix them.
Yeah, that's the goal. So, a lot of people go into medicine to save lives. I go into save lifestyles. That's what I like to do. So getting people to be active and do the things they want to do. And you say technology, we were a little bit slow as orthopedic surgeons to adopt things like ultrasound and these types of technologies that we now utilize to really, as you said, pinpoint where the pathology is, where the injury is, and come up with a more comprehensive and specified treatment plan.
Yeah. So what would something you would do with someone who comes in with that rotary cup or with, of course, the knee injuries and stuff?
Sure. So expectations, we want to know exactly what's going on. So some type of advanced imaging is common for those things. Advanced imaging, CT scan or MRI, or even special types of MRIs where we inject dyes to really better understand the injury. Then once that's there, there's a whole list of treatment options from specified exercise programs, certain modalities with a physical therapist. We were talking before about certain accessory things that really help make patients' lives better. Yeah. Or injections, and there's different types of injections. There's buzzwords around things like PRP or stem cells, and understanding what those are and when they're applicable and when they're not. And as a last resort, surgery. The vast majority of these injuries don't require surgery. So even though I am a surgeon, most of my treatment is not surgery.
Yeah. I know a lot of people are kind of like trying to, how can I say, be that bigger person and going, you know what, I'm just going to throw some dirt on it, and of course, I'll get back out there tomorrow and do it.
Sure.
That's not the smartest thing to do, am I right nowadays?
You are right. Most of the time, just rubbing the dirt on it, it can prolong the time you're down and really cause you more pain and suffering than you need. Going to the doctor doesn't have to be scary anymore. It's no longer the day of, like you were a child in elementary school and the principal's telling you exactly what to do. Now it's more of a collaborative effort of how can we help you get back to doing what you want to do, and who else do we need to involve in that treatment plan? Is it a physical therapist? Is it an athletic trainer? Is it someone else? But the goal is to get you back and really listen to what your desires and needs are.
Yeah, I like what you just said there, and that's the important part about Dignity Health. In general, the whole, of course, health care that you guys do there, and that is to listen to the people and to work with them, because the only way you're going to find out is by talking to them, not just saying, okay, you know what, you played pickleball the other day, it's this. No, you got to listen to them because everyone's different.
Correct. There's been a big push in my field within orthopedics lately that our goal is to listen to specific patients. It used to be a 55-year-old would show up with a torn ACL and we'd say, oh, you're 55, good luck. That's not the case anymore. People are active. People want to be able to do those things, and so we really listen to what patients' goals of care are and what they like to do, and we tailor it to them.
Yeah, I like that. Doctor, this is great, especially as we get ready for the warmer weather, people outside, hiking, camping, playing pickleball.
Exactly.
Different things. Where can people find out more information?
So we have a website. It's dignityhealth.org/azortho. I think it's going to be listed on the screen. Yeah.
And that's the place to go.
Yeah.
Perfect. Well, I appreciate it. Thank you very much. And don't forget, you also find out information on aztv.com with all the things we've been doing with Dignity Health, and especially went round for those weekend warriors. All right, let's get taken care of.
Awesome. Thank you so much for having me.
All right, thank you.